best pregnancy I ever had.
Yeah. You'll see in the ligaments that if it's tight, the key is just to releasing that ligament so it can create more space for the baby to drop. We've been training for a while. So now we are coming towards, you got like a month left?
So right now I'll be 33 weeks this weekend. So
Okay.
7 weeks.
Yeah. Okay.
Give or take.
Yeah, so, and she's holding the pregnancy well, skin glowing, on point. Yeah, feeling pretty good. Main thing was her first 2 pregnancies, she got a lot of discomfort in the hip. That was bothering her a lot throughout the pregnancy. So this time we're keeping that pain away and more so just focusing on having the baby in the right position and then that she has a super safe, smooth delivery the natural way. All right, so now we're just more so checking the position of the baby. Where is it at? And then based off of that, we'll determine how we're going to release the round ligaments to either get the baby to move more into the southern position, or if the baby's in a good position, then we might just do a hip release and not really more focus on the round ligament. This process, you don't want to really jab too much. You just want to slowly melt into the stomach. And the lighter, the more you feel, actually. So, yeah, now he's moving right there. He can feel it, so he's giving a little kick. Okay. So with that, what we're gonna do is release this round ligament here. Good. She moves through the pregnancy. The pituitary gland in the brain starts to regulate the hormones due to the pregnancy, so it starts to increase more relaxin, which we'll start seeing settling the ligaments, making them more softer, so then it can create space for that baby to grow and creating more elastin for her stomach so she can just continue to house this baby. You'll see in the ligaments that if it's tight, the key is just to releasing that ligament so it can create more space for the baby to drop. And usually for babies that are in a breach or in a certain position that's not favorable, we will release certain things with the option for the baby to move around and turn there. Because when they feel more compressed and hoisted up more north, then they're going to be in a more breech position is typically what we find in 80%, 85% of mothers. So whenever we can release the tension in the round ligaments and the stomach drops, then the baby usually wiggles around and gets into a more favorable position. Okay, let's check the neck out here. So we got a right occiput. Good. Good. Come up.
All right.
And then I'm gonna have you go ahead on the wall. So this is to approximate the iliums, which creates more space and relaxes the hip for the long. So you go here. You can move your feet up a little bit.
Okay.
Yep. Shoulder width apart. Yep. And then you're gonna let the stomach just drop. There you go. Just relax the stomach here. And then we'll just come here. Deep breath in. And all the way out. And deep breath in. And all the way out. And one more. And all the way out. Good. And so that's also, if you angle it, you can hit the sacral tuberous ligament, which is also key on relaxing that.
This is the best pregnancy I ever had.
Yeah. Awesome.
Yeah. So I'm ready. We're training.
Yeah, absolutely. I'm grateful to be a part of it, honestly.
Thank you so much.
Yeah, thank you.